Turning and positioning a client on bed. It is a technique in repositioning client on bed, and the purpose is it aims to prevent complications that may arise while is confined in bed, position client for comfort and body alignment, and positions client for a variety of clinical procedures. Assess client's physical abilities, level of comfort, and ability to follow instructions. Check client's chart for diagnosis and identify the client, explain the procedure to the client, and place or assess the client in a starting position. Dorsal or supine, lying horizontally on the back. Slide patient and mattress to head of the bed and remove the pillow. Lower head of the bed unless contraindicated. Turn patient onto his back. Replace pillow. Wash hands. Dorsal recumbent. Slide patient and mattress to head of the bed and remove the pillow. Lower head of the bed unless contraindicated. Turn patient into back and assist patient to raise legs, bend knees, and allow legs to relax. And replace the pillow. Wash hands. There are several types of Fowler's positions. Low Fowler's position is when the head of bed is elevated 15 to 30 degrees. Semi-Fowler's position is 30 to 45 degrees. High Fowler's position is 80 to 90 degrees. Fowler's posture assumed by the patient when head of the bed is raised approximately 15 to 90 degrees. Slide patient and mattress to head of the bed and remove the pillow. Raise head of the bed to desired degrees. Replace pillow, slightly raise foot of bed. Wash hands. Sims position or lateral and sideline. Have the client flex his knees and place his arms across his chest. Place your hands on the client's shoulder and hip on the far side. Spread your feet, flex your knees, place one foot behind the other while rocking backward and gently roll the client towards you. Raise the bed rails and move to the opposite side of the bed. Adjust the client until he or she is in correct sideline position. A pillow may be placed to support client's head and arms. Prone position. Move the client to the extreme edge of the bed. Raise the side rails on that side and move to the other side and move to the other side of the bed. Place the patient's near arm under his buttocks with a palm up, bringing his far leg over the leg near you. Spread your feet, flex your knees, and place one foot behind the other and gently pull and roll the client towards you onto his abdomen. Move the client on the center of the bed. A shallow pillow may be used to support the client's head. Wash hands. Evaluation. Evaluate client's tolerance and response to the procedure. Evaluate the client's position for alignment. Evaluate any abnormal findings on skin. Assessment. Documentation. Record the client's position. Record any complaints of pain, dyspnea, and discomfort observed during repositioning. Record the client's response after the procedure. Transferring technique. It is use of proper body mechanics in repositioning, lifting, and transferring of patients safely. Assisting client from bed to wheelchair or chair. Check the doctor's order and client's diagnosis and restrictions. Assess the client's ability, level of comfort and muscle strength, and presence of paralysis and ability to follow instructions. Wash hands. Identify client and inform client about desired purpose and destination. Lower the height of the bed and slowly lifter and client pivot so the lifter and client's back is toward chair, lifter still holding the transfer belt. Instruct client to use armrest on chair, flex hips and knees while lowering into chair or wheelchair. Secure the safety belt, place the client's foot on pedal. Wash hands. Assisting client from bed to stretcher, 3 assistants.